please welcome doctor. Good morning, doctor.
Good morning, Khun Thanya. Good morning, everyone. I am Dr. Nithi Nawanimikun from Bangkok Hospital Pattaya. I worked in Bangkok Hospital Pattaya for 10 years, specialized on the urologist and water vapor therapy. I have the experience to treat the patients who have the prostate problem more than 5,000 cases.
Oh, that's very high experience. But doctor, you should understand I'm a lady. So the first question will be, I want to understand the primary prostate function.
Okay, we start with the prostate. The prostate is underneath the bladder, surround the urethra, hiding in the pelvis. The primary function of the prostate is to produce the fluid, make the sperm alive.
Yeah, okay. So the prostate is a part of the body organs. So there will be the problem, right? What are the symptoms of the BPH?
Okay, the prostate was getting bigger by the aging and can make the people got any problem. The prostate will grow up after 40 years old and start to get the problem after 50 years old in the 50% of the patients. The symptom of the prostate, the patients will have the difficulty urination. The urine flow is not too strong. The patients maybe can't feeling empty your bladder, and some of the cases have to wake up many times in the night for the urination. Also have the urinary frequencies and the urgency.
Oh, that is the sound is the many problem when you have this kind of BPH symptoms. So okay, so if you guys are having this kind of problem that the doctor mentions, what can we do?
The first, we have to talk with the doctor and show about your symptoms. The doctor will provide to do the physical examinations, also the rectal examinations. Later that, we have to do the further investigations as the ultrasound, the blood test for the PSA, that's for screening the prostate cancer. We have to check the kidney functions, we call the creatinine, and the simple urine test. The additional investigations, the uroflowmetry, to measuring how flow that you had will be advised.
Okay, so on screen will be show the treatment that the doctor mentioned about the lab test, the PSA test, and also for the additional test to see and clear and confirm that you might have the BPH problem. You know, doctor, the BPH is the benign possessive hyperplasia, but in another word, is the Bangkok Pattaya Hospital. But how like connect us? Okay, let's back to the BPH right now. And how about after the patient was diagnosed for BPH? What would you recommend them the treatment?
Okay. We recommend we start with the modified lifestyle modifications as we have to drink less water after dinner. You have to avoid the caffeine and the alcohol in the patients who have the mild symptoms. In the patients who have the moderate to severe symptoms, you have to start with the medication. For the medications, the patients have to take forever and also have the side effect. The effect of the medication is about the sexual functions.
Oh, wow.
It's as like you have the loss of the libido, erectile dysfunctions, and most of the case is
really
have the retrograde ejaculations, but it's like a temporary. And also the high cost of the medications that you have to pay every month.
Oh, it's expensive, right?
Yes, that's right. Anyway, in the patients who took the medications and you not got any good response, the prostate surgery we call the TURP or the laser treatment has been recommended. Anyway, it has the side effect also. The side effect that we have is the scar formation. It has the erectile dysfunctions. And the most important thing that you will have the permanently retrograde ejaculation
Oh,
that we found 80% of the patients.
oh, okay, okay, all right. I could say that I have like understanding about the BPH symptom and also the treatment, what doctor mentioned about the medication and also the surgery. If I am a man, I could say that I will do something to help me out. But of course, as the doctor mentioned about the expensive prostate medication, and you will take for your whole life and might not get any better. And also the side effect of taking the medication for a long time and the surgery that the doctor called TURP, the complication that would be happening to you or your patient. So that's why today we are going to discuss about the new alternative treatment. Is this help?
Yes, it is.
Okay, all right. Let's see how it works.
Resume water vapor therapy is a non-surgical treatment for BPH. Resume uses the natural energy found in steam to shrink the prostate. In just seconds, this precise technology destroys enlarged prostate tissue while minimizing any effect on surrounding tissue. Resume is a potential alternative to drug therapy, permanent implants, and surgery. It preserves sexual and urinary functions, and it's clinically proven to safely and effectively reduce BPH symptoms. Potential side effects include painful urination, blood in the urine or semen, pelvic pain, and urinary frequency, retention, or urgency. The procedure is performed right in your doctor's office or outpatient center. You do not need general anesthesia for the procedure, and Resume therapy lets you quickly return to normal activities. Talk to your doctor about Resume if you're no longer comfortable with your BPH symptoms. Drug therapy isn't working for you. The side effects from drugs are impacting your quality of life, or you don't want to have surgery or get an implant.
Wow, this sounds really interesting. Yes, even our ladies, I hear that there's something could help you out. So now let's talk about Resume. Okay, let's say Resume. What is the Resume?
The Resume is the new technology that launched since 2015.
Mm-hmm.
The machines produce the hot stream 103 degrees Celsius. We have to start with the instrument and the camera in the urethra to the prostate area. After that, we have to measure how many injection sites that we need. It's up to your prostate size. Later, the machine will, the needle will be deployed, the needle into the prostate tissue, and the machine will inject the hot stream in the prostate tissue for 9 seconds each injection site. Finally, we found that the prostate cell will be dead immediately, and your body will absorb the cell death by naturally, and it's worked after 2 weeks. Should come be maximum effect at 3 weeks, 3 months time.
So it's not that too long road for you to recovery or even have this procedure. So what I have seen on the video, okay, a minute ago, the procedure is very fast.
Yes, that's right. The procedure, the Resume therapy, is take time only around 15 minutes.
Oh.
And it does not require the general anesthesia. You don't have to stay in hospital. Anyway, the most important thing is preserve the sexual functions, also the erectile functions, and it has no retrograde ejaculations like the medications or the prostate med.
So the one important point, I think when you say about the sexual function, I think this is the point. And this also, they can preserve the sexual function and you don't have to take maybe no longer medication. And one more thing that I heard about this procedure is take 15 minutes. Let's say it's less than 1 hour. It's
Yeah.
like a day procedure. So you'll be here with the doctor and then the procedure, and then you have to stay in the room to recover, and you can go home, right?
That's right.
Ah,
That's right. It's
you-
very easy and
Uh-huh.
simple.
Oh, but the benefits is very high for the patient. Okay, so if I understand correctly, the resume is might not suitable for all the people. I mean, for the guys, for the older guys. So who is suitable for the resume?
Yeah. Who is suitable for the resume? The resume is suitable for the patients who have the prostate enlargement size between 30 to 80 grams. The patient does not want to take the medication forever, or anyway you have some side effect from the medications. The TURP are not the best solutions because you are unfit for the general anesthesia, or your symptom is not too severe to take the surgery.
Oh, okay. So it's clear. It's more clear about the criteria to have this procedure. So, okay, let's say if the patient, they already have this procedure done with you here in Bangkok Hospital, Pattaya. So what do we do right after the procedure?
Okay, after the procedure, the patients have to have inserted the urethral catheter, and you will have the small bag on your leg for 5 to 7 days. It's because when we put the hot stream in the prostate cell, the cell is was swelling, and some patients may be unable to boil for a few days. After we take out the catheter, you will be able to go to the regular activities within a week.
1 week?
Yes, 1 week.
Wow. Okay, let's say you can back to your quality of life 1 week after the procedure, and you can back to your activity, like if you are playing sport, you like to stay at home, doing garden, or do a lot of activity, you can do it after a week of the procedure. Wow. And the resume is proof, right?
The resume is have many researches, and it was proved by the FDA United States of America and also FDA Thailand. It's proof that the resume therapy relieve your symptoms and safely and effectively. Thank you.
Yes, thank you very much, doctor, for the procedure information. I believe that you guys to get more information about the water vapor therapy. However, I have invited our patient who have an experience with the resume a few months ago, and he's here with me. Please welcome Mr. Love His.
My name is Rolf Hitz. I'm 70 years old and I came from Switzerland. I came to Thailand about 7 years back, bought a house in Bang Saen and with a big garden because I like gardening very much.
Yeah, thank you. And I heard about you are very happy that you
Yes.
can back to your normal life and normal activity that you have done before. So I'm sorry that I would like to ask this question to you. What was the symptom that made you to come to see the doctor?
Yeah, it is about 3 years back, a little more than 3 years back. I have to go for pee very often and the flow was also very soft. Sometimes in the night go up 1 or 2 times, or sometimes also urgently to urinate. And then I was thinking I make a complete body check here in the hospital in Pattaya. And then we see we had the enlarged prostate.
And how long have you been having this problem? I mean, BPH problem?
About 3 years. But I was thinking for old men, it's normal, you know, that you have some small problems. But later on, then I see, no, it's not so normal.
So about this procedure, so you came to see the doctor, and then you have to make decision or decide that you are going to have this or you are not. What did the doctor advise you?
Yeah, at the beginning, when after test we see that I have this prostate problem, He told me to take some medicine, this Duodart, but it was also very expensive. And later on, when he told me that he has now this new integration system, I was interested. And he explained very well and in detail what happened and what is the advantage. And he gave me some time to think about. And I was going home then, look a little bit in internet and find more or less the same as he told me also. Then I decided, yes, I will do it.
Okay. So after the procedure, what do you do or what happened to you immediately? And how long would it take you to back to your normal life?
Yeah, after the procedure, you get this catheter for the 5 days. But later, when you take out the catheter, then it's much more or less normal. The only one was that at 1-2 weeks, still I have to go more often for pee, but it is going better from one day to another. And after 3 weeks, it was much better. And when you see the flow test we make before the surgery and 4 weeks later, so you see a big difference then. So the surgery was very successful.
Okay, so the sound that you are so happy about, and what are you doing right now?
Yeah, I was going back to normal life, so no medicine, which also you can save a lot of money. So it has cost me 40,000 baht for 1 year for this Duodart. And what is nice also from the surgery, after surgery, you can go home. This is an advantage. The same day you go home. Of course, these 5 days with the catheter is not so nice, but then you go back to more or less to a normal life, which is much more comfortable than before. And I can do now everything. I go with bicycle, I can do gardening, and not go up in the nights for pee. And this is very nice, make my life more comfortable.
Yeah, very nice to hear that, and I'm also happy for you. So I believe that all the guests here with us on the webinar today, and also the men around the world and also in Thailand, they're also having this problem, and they're no longer comfortable or happy with the medication, but they don't want to have the surgery. What would you like to say to them?
I would recommend them all to make this surgery with this Retsem system, which goes very fast, is nice. You can go a short time after that to normal life, better life, more comfortable. And especially here in the Bangkok Hospital in Pattaya, all the doctors and the nurses, they're well trained, educated, work professionally, and take care very good and very nice. I would do it again. And you can save money also, not take medicine, not have side effects.
Thank you very much, Rob, for joining us today. The experience you share to us and to the guests on the webinar, very impressed and very useful. Okay, thank you very much.